If we talk about your anxiety, can you explain to me what goes through your mind? If you are in a social situation, what makes you anxious?
Well, the thoughts of other people about me.
Mm-hmm. What they think about you.
Yeah.
And what do they think about you? What makes you anxious?
Like that silent one, stupid, not very social, failure. Bit of an ass.
So a lot of negative thoughts. People think I'm an ass. People think I'm a failure.
Yeah.
What else?
Silent, withdrawn.
Maybe that's a bit of a fact. You are silent and withdrawn, aren't you?
Yeah. Yeah.
But the others
That's
are
true.
probably more assumption. I don't think you're necessarily a failure or an ass.
Hmm.
Do you see the difference between these?
Yeah.
Okay.
Yeah.
Yeah.
Okay. Yeah.
Because I can understand if you are afraid that other people will think you're a failure, you withdraw. And so if they see that you withdraw, it's more like an observation than an assumption. Am I right?
Yeah.
Okay.
Yeah.
Maybe for now it's not that important, but...
No, okay, yeah.
Okay. So if I ask you what makes you anxious in contact with other people, basically it comes to the idea that other people will reject you if they get to know you.
Yeah. Yeah, maybe.
You're not sure if that's is the term rejection does not fit in this case?
No, I never thought about it like that, but maybe you're right, yeah.
Mm-hmm.
Yeah.
Okay. Yeah. It has to sink in a little bit, but
yeah.
How do you feel about it?
I know, it's kind of confronting to call it rejection. That's just...
Okay,
yeah.
It disturbs you.
Yeah.
Yeah, I understand, yeah. And what are the thoughts that makes you sad?
That I'm not part of things, that I'm doing the job that I'm doing.
What's wrong with your job?
It's okay, but not, I don't like it very much. Simple. I mean, I can do it, but...
And what does that say about you? How do you think about yourself related to the job you're doing?
Failed. It's like my dad gave me that job because I couldn't do anything else, so kind of put me there and I do the job, but...
And that's about it.
Yeah.
Yeah. Is it the thought like, I'm a failure?
Yeah.
I'm not good enough?
Yeah.
That's a tough one, I guess. If you think so badly about yourself, I can understand that you feel really depressed. once in a while.
Yeah.
If you look at what I filled in some of the information you gave me, do you have any idea what the meaning of this is, what I'm doing?
Well, it looks like you're kind of breaking down in segments.
Right, yeah. And why am I doing that? What's the idea?
To make it clear.
Mm-hmm. And does it make it more clear for you?
I don't know. Yeah. Yeah, I think so.
Okay.
Yeah.
Yeah. Yeah, basically the idea is that these three fragments, as you call it, they're in some way interconnected.
Mm.
Like how you think about yourself and the world and others is related to how you feel. And how you think and feel is related to how you behave. Let's give you a very simple example. Like if you're afraid of a dog, well, what do you do when you're afraid of a dog? When you see a dog?
Walk away, run away.
Walk away, yeah. And what would be the reason for someone who's afraid of a dog? What do you think his or her thoughts are about dogs? What kind of thoughts will make them afraid?
Biting.
Biting, right.
Yeah.
So there you see the connectedness. You think dogs bite. When you see a dog, you become afraid, anxious, and you avoid or you flee when you are confronted with a dog.
Okay. Yeah, I see now.
Basically, these are let's say, the keystones of cognitive behavior therapy. So you can say that two words, cognitive, cognitions, that's about thoughts, and behavior, well, is about behavior.
Mm.
And it's also about emotions. These three are interconnected. And probably the same with a person who's afraid of dogs. I mean, not everybody is afraid of a dog. So what you can see that somebody who's afraid of a dog has specific ideas about dogs, but these ideas are not necessarily realistic ideas.
Mm.
And what you do in cognitive behavior therapy is investigate together the thoughts you're having, especially the thoughts that are very much connected to all kinds of emotions and behaviors, to investigate if these thoughts are realistic or if they need to be changed. Can you follow me so far?
Yeah, I think so, yeah.
Yeah. If you look at your own thoughts, I wrote them down for you. What do you think? Are you sure these thoughts are realistic? Like the idea, I'm a failure.
Yeah.
Are you absolutely 100% sure that it is a scientific fact that you are a failure?
Yeah.
You are. Okay. So these thoughts feel like facts.
Yeah.
If I ask Alicia, do you think Richard is a failure? What would you reckon she would answer?
Yeah. She would say yes.
So, correct me if I'm wrong. Is it very likely that you stay with a person while you think he's a failure?
No.
So that there's some conflicting evidence, probably. You say on one hand, I'm quite sure that she will think I'm a failure too. And on the other hand, you say, well, it's not very logic that you stay with someone who you think is a failure. There's some contradiction, isn't there?
Yeah.
Does it make you uncomfortable? That contradiction, or?
Well, I'm thinking, is she then gonna leave me?
Well, is she? Is she planning to do so? Is she telling you that she wants to leave you?
Not now, but maybe in the future.
Okay. So you're asking yourself, is it contradictory, what I'm saying? Maybe it's all the same and it's all evidence for that I'm a failure.
Yeah.
Of course you can be right, but you also can be wrong. I don't know. Are you willing to investigate your assumptions about how others think of you, how you think of yourself? As if there's a possibility that what you think is not true.
I think I should.
You should.